Jennifer Tierney is the Executive Director of Médecins Sans Frontières Australia and joins us now. Jennifer, thank you for coming in. We know that many Palestinians are fleeing this area anyway, knowing that a battle is looming. If this offensive goes ahead, what will it mean for civilians there?
I mean, I think we have to note that they've been asked to move to Rafah for safety. So they've evacuated their homes and their communities as it is. In doing that, they cut themselves off from all of the assets that they need to survive: clean water, food supply, income, shelter. They're moving to Rafah, and now the offensive is coming there, going to displace them again to where? A territory that's been absolutely razed to the ground. And so that compounds the humanitarian health issues for everyone.
How are your medical teams faring there?
I mean, they're struggling immensely. They're doing absolutely everything they can. I mean, a lot of the work that we're doing right now is focusing on burns and rehabilitation. But, you know, for instance, the hospitals are not safe. We have had staff who have been killed in hospitals. And so the idea that we can function on any ongoing basis with security, I mean, that idea was really scuttled a long time ago. So we're constantly trying to reposition ourselves to be in a place where we can provide care. But the ongoing care that these complicated injuries, that folks with complicated injuries really need, is just not available. So let's say you have somebody, and many, many limbs have been lost, many, tens of thousands in this conflict. And they're now getting terrible infections and need wound care, but they're living in unsanitary conditions, not in home, not with clean water. And so the medical situation is catastrophic, just completely catastrophic. And we're not able to even touch the surface of it at this point.
Have medical staff been directly targeted in this war?
They have been hit, for sure. I mean, we have evacuated facilities 9 times over this war. We have been hit by sniper fire, by tanks, by aerial bombardment, and by ground forces. And so, yes, I mean, whether or not they are targeted, I can't get into the minds of the Israeli Defense Forces, but I can say that they've certainly not been preserved. The sanctity of medical humanitarian care is not being preserved, and it's a violation of international humanitarian law.
Now, MSF is calling for Israel to halt this offensive. Is there power in that call, or is there a sense of powerlessness?
We will always stand on the side of our patients, and what they need right now is a voice in the international community that is calling for their safety, their security, for the women, the children, the civilians, the tens of thousands of people who have died, for the people caught in the rubble at this stage. So we have to speak out. We are immensely frustrated that governments like the Australian government, like the US government, are not heeding these calls faster, with more authority, and with denying the Israeli Defense Forces the funding and support that they need to be able to execute these atrocities.
And with this offensive looming, do you think it will be possible to continue the work in Gaza?
It becomes more and more challenging. You know, again, we have adapted. We've moved where we're working. As the attacks have moved, we have moved ourselves. But it is day to day for us, absolutely day to day.
Jennifer Tierney, Executive Director of MSF Australia. Thanks for coming in.
Thank you.